Hi, I'm Bob Baravarian from University Foot and Ankle Institute here in Los Angeles, and I wanted to talk to you about what to do if a Cartiva implant fails. The studies for Cartiva have been exceptional, and it is a procedure that we do, and in many cases the patients have a very successful outcome. But putting an implant this size into a joint sometimes doesn't work because the great toe joint has multiple surfaces, including two little bones on the bottom, which are like kneecaps, and sometimes the arthritis in the joint is more than the implant can handle, and sometimes the implant has been noted to sink into the bone. And this is a complication that can be happening with any implant, but with the Cartiva we've seen a number of patients who come in and the implant either has not been placed properly or it has sunk into the bone over time. And so the question is, well, what do? You can't put another implant in because it'll sink the same depth. There isn't really another Cartiva that's bigger. And so the options are some form of other implant. Here at University Foot and Ankle, we've been involved with the Arthrosurface implant for years. We've seen the improvement in the Arthrosurface implant. And basically what this implant is a two-piece implant, but you don't have to put both. You can do one in the base or one in the head or combine them together, which allows us more options with replacement of the joint. Most commonly, the Cartiva implant is removed, and as you can see, there's a stem that goes into the bone and a head that goes onto the stem. And this implant is much more robust, much more stable, and actually resurfaces the entire surface of the joint. The beauty of the Arthrosurface implant is that we actually want you out of the boot as quickly as possible. So normally within 5 days you're in physical therapy, within 7 to 10 days you're in a sandal or a open shoe so that your toe can move, and you're back into your regular shoes and regular activity within about 3 weeks. Often as early as 10 days, patients are back into their shoes. So don't fret if you've had a Cartiva implant that hasn't worked, and realize that there are replacements for a Cartiva that fails. And worst case scenario, in some cases, you may need a fusion, but even in that case, patients do incredibly well, but we feel very comfortable with multiple procedures that can help patients with a failed Cartiva implant.